So if you're a parent, the way to recognize that your child has experienced a traumatic event is all of a sudden symptoms suddenly show up that weren't there before, or the intensity of certain symptoms become really prominent. So they're sudden. Now, with children with autism, one of the things that is tricky is there are comorbid conditions, right? We have anxiety, sometimes we have ADHD, so there are issues with attention, there are issues with anxiety, there are behaviors that get in the way of them doing what they need to do. But all of a sudden, the intensity of ability to attend in class, ability to go to sleep, it becomes really, really intense. So, and you would know that there is a marker event after which those behaviors become rather intense. Avoidance, become really clingy. They do not leave the parent, they shadow the parents. Even I have parents who would tell me they follow him into the bathroom. They can't take a shower. They won't sleep in their bed. So there's a sudden increase in the frequency and intensity of these behaviors that is marked by an event. The parent, not all of these behaviors mean trauma as long as they're not preceded by a traumatic event. So again, the thing would be that there is a traumatic event that precedes these behaviors. So they will not show up out of nowhere. So they may need to do some detective work, what has happened at school, what has happened at home, on the playground, daycare, wherever they go. But generally they're marked by an event. And the parent would know that if most of the time, these behaviors do improve with time. But if after several weeks or 2 to 3 months, they have not improved, their intensity, their frequency has not gone down, then the parent needs to seek a therapist. And you got to also realize it's better be safe than sorry. We are talking about a child with special need. And 1 out of 6 kids has some kind of disability, developmental delays. And there are issues with communication, there are issues with cognition, there are issues with affect regulation. So they cannot quite communicate what they're going through. And so it would be, the parent may not be trained, but if they find a therapist that especially is trained not only in trauma treatment, there are various effective trauma treatments, but use of therapies like play therapy or sand therapy or art therapy. Art is also great. They can show you, even if they cannot tell you, and their communication issues.